Hello, this is Richard Collins with the Internet Foundation, and I haven't done one of these. Actually, I've been doing updates on the global COVID situation, but I've not been making videos about them. The things have settled down into a pattern, and it's not going to change for quite a while. So I'll put this out. I'll try to keep it short. I'm using the ecdceuropa.eu data, which is a nice collection of the country data on COVID cases and deaths. And there's issues with it, and I'll mention some as I'm going, but pretty much I downloaded this as is, turned it so I can edit it, and then let me show you where here. And then so the data comes down like this. I turned on filtering in Excel. I changed the continent names. So North America is Canada, the United States, and South America is their America for everybody else. So I consider these two distinct physical continents, North and South America, and sociologically, economically, and in terms of this pandemic, they're quite distinct entities. So I changed nothing else. So there now the cross tabulation in here that I did cases first, and the cross tab looks like this. Let's see if I can bring up the field list. I took the dates down for the columns, for the rows. The continent goes across here for to split it apart, and then I just summed the cases. So which, since they're unique, it's just repeats the data that's in there, but in it, well, no, it collapses it across all the countries by continent. So anyway, that's it. That's cases. I did exactly the same thing for here, except for deaths, and that's the sum of deaths. The Once I did that, I ignored Oceania, and other, and then just did Africa, Asia, Europe, North America, and South America. And let's look at the cases first, because I want to explain something here. Let's close this. All right. So this looks like really horrible for the United States, right? Okay, so what happened? Well, Europe in green goes up and then has been steadily declining. That's what you'd expect. Possibly by the near the end of the year, everybody who's going to get sick in this round of it will have. It's going to be endemic. Probably it'll come down to some level and stay there until vaccines are out. The United States started on the same path, but then went into this spike here. And you say, oh my gosh, the world's coming to an end because we have so many cases. But if you look at the deaths, it's not that. Okay, what's happened here? There are deaths in here, okay, where it's getting spikes in here. But you'll notice that the general level is downward. So what's going on is cases and positive test results are being reported extravagantly in the United States, and it's great for fundraising. It fills the coffers of all of the health departments and everybody in the business. But in terms of serious cases that lead to death, not so bad. So there was, I think the spike in here was at least some resurgence, but not. It's not to the exaggerated extent this case reporting shows. So here, I strongly encourage you, don't pay attention to the cases. They're misreporting. What they need to do is to report cases by severity and then they're going to see there's a whole bunch of people, turning up positive, and they're not ever likely to get that sick. That said, there's still a lot of people. I mean, if you look at the numbers in here, cases, even at this level, still 20,000 cases a day. So, what else is going on? Well, the cases, I put in red Asia because I think it's going to be the worst. It's got the highest population densities, it's got the highest total population, and there's nothing to prevent its continued spread. Africa, is, to some degree, is there. It's somewhat, there are large concentrations of people, and no way to stop the thing. So those are the two that I'm watching. South America's got some serious problems, and you see these jigs and jags. Those are reporting problems, okay, and coordination problems. And if you can't report consistently, how are you ever going to get on top of something? So, that's there. Let's look at the deaths real quick. There's nothing really extravagant going on here. The deaths in South America, there's a lot more of them. It's I would say, in general, I'm just making a really crude, cut through here, is that partly age structure. Well, I don't know. I could go look, but South America should not be that high. And I think it's an infrastructure coordination problem. Okay? I think of Asia as much more tightly integrated and communicative in many ways, and then, the various South American countries, not so much. These are my personal opinions. There's just, it helps me to understand what's likely to happen next. So, if I were doing South America right now, what I would do is go in there and make sure I would get this reporting so it's steady. It's not jumping around like that. It's the cases are being reported. And when they're being reported that erratically, then somebody doesn't know what's going on. So, good people, lots of trouble, globally disconnected. Okay, so, all right, well, I'll stop there. I just wanted to keep this short. This method works quite well. It's much more realistic than stacking things on top of each other where you can't really tell what the heck is going on. Split them out by continent, make North and South America distinct continents, and then you might have some chance of getting a sense of what's going on here. These things are going, even the United States and Canada are going to process till the end of the year for sure. So, and okay, and these are the deaths. Okay, so we haven't seen death. Partly, the United States and Europe are much older, so the nursing homes are getting devastated in the United States. That's my feeling. We're basically. I won't say what I was just going to say. The South America has much younger population. Their death rate per capita is going to be lower. Asia is also young. These countries, very high population countries, are quite young, and so that's in their favor in terms of death rates. So that's part of what's going on here. Africa, I haven't checked all of the details there. My guess it's going to be it's going to be a slow burn on Africa. That it's going to be for the whole continent. It's going to be there for a long time. Could Asia go up and come back down again before the end of the year? There's billions of people literally to infect and process, and it's in every small community almost now. Certainly in the larger chunks and regions, and then all it takes is getting one out there. This appears to be, 365 day a year process. This is not a summer cold or winter flu sort of thing. It looks like this is that's why they called it a pandemic. So, anyway, that's my read on it. And to me, it's more depressing because of lack of coordination than it is, well, no, it's depressing across the board for a lot of reasons. I haven't been able to get any of the groups that I think ought to be working faster to move any faster. They have no incentive to do so. The longer it takes, the more complicated it is, the more expensive it is, the more money people make. There is nothing, not a single incentive in the world to make this go faster. The research go faster, the solutions go faster. People talk to each other faster. People share in ways that cut down the total time on this. That's my point as the Internet Foundation. If you can cut out humans out of every step in the research process, you put it on paper, someone reads it. They read it, they write something on paper, somebody else reads it. That chain of human reading and absorption is getting in the way of sharing the data, the models, and essentially all the plans. There is no written plan for the whole world. There ought to be. There is no written global status of everything that's going on, research and everything else. People dump out lists of research papers. Oh, that's really informative, and that means people have to read it, absorb it, try to comprehend it, curate it, consolidate it, compress it, make sense of it, find plans and efforts from that, write those down, get other people to read them, and it's just a long chain of humans in the loop. It can be done if you do central models, central data, central reporting, and communication nodes. They can be done with great security and professionalism. They could be done faster and with the current best technologies our species can come up with. But there's no incentive to do so. So that's kind of why I quit doing these things. I'm still working on it. The Internet Foundation, that's me. I'll continue to try to find solutions, but I have no hope at this point that anything's going to change quickly. It could. There's absolutely nothing except humans standing in the way. Oh, well. All right. I've had my say. Thanks for listening.